Hello, this is Violette Haldane with the West Indian Foundation, and this is our Coalition Community Conversation. This evening, we are going to be talking about COVID, and we have a special guest, Dr. Rhule, who will be presenting for us. So I'm going to turn it over to Dr. Rhule, and he will give you a little bit about his background and then take us on this journey through this topic. Thank you. Dr. Rhule?
Thank you, Violette. Well, welcome everyone. So I am Dr. Gary Rhule. I'm a board-certified internist with lots of years practice in the emergency department, and I'm the former director of public health or health and human services in the city of Hartford, and I do a lot of healthcare management and a lot of community work. But as a public health practitioner, this work is really important to me to let the community know about COVID-19. And as you know, there is a constant update, so this I think is very timely. And we'll go through some information that I think is really important for you to know, and then we'll have a question and answer at the very end. So if we're all set, I'll share my slides, Ms. Violette.
Okay.
Can you see the slide?
Yes.
Okay, I have to minimize so I can actually see myself here. All right, so welcome again and good evening to everyone, to the community in Hartford and the greater Hartford area who's listening. This is the COVID-19 workshop. The COVID-19 workshop on November 9th. And so you got a flyer that this evening we'll be talking about COVID-19, some information and update. And then later on in the meeting, I'll talk about testing sites, which is actually happening from today, November 9th to the 12th. And I'll specifically talk about the sites where that's actually happening. I will just jump right in. You've probably seen lots of what's called EM photographs of what COVID-19 looks like. This is the virus with all those spikes. Those are proteins coming off of the virus. And specifically, some of the vaccines that we'll talk about will address the protein and then some of the genetic material, the protein that the virus has. So the plan for today in terms of just kind of laying out the landscape, I'm going to talk about COVID-19, global and local impact. Those really is just the statistics. That should take about 5 minutes. We'll go through COVID-19, the signs, the symptoms, the medical risks, the complications. Then we'll go back to the testing sites that are coming up both in this month, the 9th to 12th of November. And then we'll end with a Q&A and an open discussion. That should be about 10 minutes. And then if you need more information, I'll list some places that you can go to get more information. If you've been following COVID-19, so pretty much since January of 2020 is when it was recognized, and the first infections came out of China, out of Wuhan, China. And the best place to get some of the data, both globally and for the US, for Connecticut as well as a county level, is that Johns Hopkins University has a data resource, a website that tracks these numbers. And so as of today, obviously these numbers change, right? So as of today, there are about 50 million infections globally. 33 million have recovered. In the US, today we hit the $10 million mark, not dollars, 10 million mark for persons infected. And we've had 237,000 deaths. In Connecticut, infections, 78,000. The total tests that have been done so far is about 2.4 million. We've had 4671 deaths, and the positivity rate is 3.1%. That fluctuates because the way that is numbered, it depends on the roll in last 7 days. So sometimes it goes up, sometimes it goes down. 9,800 persons have recovered. In Hartford County, the infections have been 19,769 and 1,505 deaths. I did not include the specific numbers for Hartford because what you have to do is kind of pull data from several places, but you really get a gist of the infections specifically in Hartford. And that's about Hartford County, that's about 20,000. So what is COVID-19? It's a severe acute respiratory syndrome, coronavirus 2, or SARS-CoV-2. It's a virus that causes COVID-19, and it's a type of virus that's called an RNA virus. There are different types of virus. Some of them are double-stranded, some of them are single-stranded. This one is a special type called an RNA virus, which is different from a bacteria. So you have different type of germs, right? You have viruses, you have fungus, you have bacteria, you have other things. This is a specific virus. It's newly recognized, it's novel, we haven't seen it before, we're still learning. And I put this here to just make you realize that we're still learning a lot about it. And in the last 9 months, I think we've learned a lot in terms of who's at risk, the complications, the treatments, and things that you should do to keep well. And the reason that this is timely is that because of the newness of this infection, it's really important that you keep up to date with the information, what's new, new treatments, there's no cure. And today we heard some information about the vaccine. I'll talk about that later. And I'll give you some resources to which you can look to see about where you could go if you want new information. What's not going to change? This virus primarily gets infected by a respiratory means. It's respiratory, it's by droplets, it's airborne, and persons get infected through your nose, your mouth, your lungs, and your eyes. You also obviously get infected by touching surfaces that are infected with the virus, and then you touch your nose, your eyes, your mouth, and really into your respiratory system. What are the symptoms of COVID-19? Fever, cough, shortness of breath or difficulty breathing, chills, muscle aches and pain, headache, sore throat, new loss of taste or a new loss of smell. Some people describe like they feel like they smell something burning, is what some folks kind of say. Congestion or a runny nose, nausea or vomiting, or diarrhea. And this list is not exhausting because people get other symptoms. And I'll talk about what you should do if you have symptoms and you believe you've been exposed and what you should be doing. But those are the common symptoms that you have: fever, cough, shortness of breath, primarily respiratory. The symptoms appear 2 to 14 days after exposure, and you have a wide range of symptoms. Some people who get infected with COVID-19 have no symptoms at all. Other persons have mild symptoms. Some persons have severe symptoms. As you've seen, some persons have severe symptoms where they end up have difficulty breathing, they need oxygen, they're in a ventilator, their kidneys may fail, their hearts may fail, and it's a multi-system problem that they have. If you develop symptoms and you think you have been exposed to COVID-19, you should call a healthcare provider immediately to get really information, and they will guide your care. What symptoms should you be alarmed about? I have this in red. When do you see a doctor? If you have trouble breathing, persistent chest pain or chest pressure, if you're falling asleep, you can't stay awake, right? So it's affecting your brain function, new confusion. If your lips are turning blue, your face is turning blue, which really means that you don't have adequate oxygen in your blood, that your lungs aren't working properly, you should call your doctor, and your caregiver or your parent or somebody who is concerned should call, if you can't call, obviously. Another picture of the virus, just another way to see all this, the protein spiking out of the virus head right there. who is at increased risk? So, we see a lot of these visions of young persons who at parties, on a football field, because they believe that even if they become infected, the risk of them having a serious illness from it isn't going to happen. And that's not true. Young persons have died. We've had pediatric cases where they've died. Young, healthy college students have died from this disease. But even with that said, the risks are in persons greater than 60 years old. And as you increase in age, the risk for serious illness increases, as well as if you have chronic medical conditions. And this list, again, is not exhaustive, but the things that put you at risk, despite your age, despite being 60 or older, are heart diseases, heart failure. Have you had a heart attack? Problems with your heart muscle, that's what cardiomyopathy means. Cancer, COPD, diabetes, obesity or severe obesity, if you smoke, if you have chronic kidney disease, if you have things like sickle cell disease, if your immune system is weakened from any reasons, either you've had a transplant, pregnancy, asthma, liver disease, overweight, any chronic lung problem like cystic fibrosis, pulmonary fibrosis, that means really just scarring in your lungs, any brain or nervous system conditions, anything that weakens your immune system and your bone marrow, having a bone marrow transplant, having HIV disease. Some medications also affects your immune system. Some steroids do that. Diabetes again, high blood pressure. If you have these chronic medical conditions, those things or these things put you at higher risk for severe illness. And what we mean by severe illness is that you end up having the alarm symptoms, difficulty breathing, shortness of breath, in the hospital, needed oxygen, may even need to be in a ventilator, having your kidneys fail, maybe needing a machine to clean your kidneys, dialysis, and really those complications. Those are serious complications. You don't want to have those things. So the list that we just went through does not list all the conditions, but the things I would remember really are probably 4 of them. Any heart conditions, anything that affects your lungs, high blood pressure, diabetes, those things put you at risk. And definitely if you smoke, those things put you at risk. It's really important that you speak with your healthcare provider so he or she can actually tell you if the things I just mentioned are not something that you have or you have another medical condition, to really speak with them to understand what your risks are. We talked about how this is primarily a respiratory problem, right? So what does that mean? By your breathing, your coughing, your sneezing, your talking, your singing. Those things basically disperse the virus in the air. If you're passing by, it then infects your eyes, your lungs, your nose, your mouth, things of that nature. It may fall on the surface, so that if you touch a surface with a virus on it, and then you touch the places I just mentioned, you then end up infecting yourself, right? Just a nice in the picture to show you that COVID-19 basically is worldwide. There are very few places, I think, that haven't had an infection. So how do we stop the spread of COVID, recognizing that primarily it's a respiratory disease, it's airborne? How do you stop it? The way to stop it is stay home as advised. So you consult with your healthcare provider, stay home as you need to. If you're being exposed, to quarantine yourself, to stay home. Wearing a face mask that must cover your nose and your mouth. I've been out in public and people are really conscientious. They have the mask on, but the mask only covers their mouth. That's ineffective. The mask must fully cover both your nose and your mouth. It must have a proper fit, because if you don't do that, as you breathe out through your nose, you're actually dispersing the virus into the atmosphere. So the mask must cover your nose and your mouth. If you need to cough and sneeze, that should be covered. Ideally, you cough into your elbow, you sneeze into your elbow, and or you sneeze into a tissue. Immediately discard that tissue, and then you have to wash your hands. Social distance, it's respiratory, it's in the air. Minimum 6 feet apart. So you're going to put your mask on. If you're in public, 6 feet apart as much as you can, much further if you can. So those are the primary things, as well as washing your hands at least 20 seconds with soap and water. So you can do your birthday song at the pipe, put the soap and water on, wash your hands, sing the birthday song, soap and water, dry your hands, discard the thing you dry your hands in a wastebasket. Avoid touching the places through which the virus enters your body, right? So your face, your eyes, your nose, your mouth. So try not to do that. Cleaning and disinfecting frequently touched surfaces and objects, like your cell phone. Wipe those down. Your desk at work, your keyboard, anything that you're touching frequently, you want to clean. Clean really just means you're going to use soap and water to clean it off. Disinfect means you're going to use a FDA or an EPA, approved disinfectant, but really alcohol can do it, right? So alcohol can clean it off. To clean the surface, Lysol if you have Lysol, or any other product that disinfects to clean the surface. Disinfect the surface. And then of course, if you need medical care, you need to call first. So if you're going to go to the dentist or your doctor or whomever you're going to go to, make sure you call, especially if you think that you've been exposed to COVID-19. Before you show up at your doctor's office, your healthcare provider's office, and you think you've been exposed, you want to call them and tell them you think you've been exposed, because they'll have specific instructions for you. They'll most likely have you come to the parking lot, text them that you're there, make sure you go with a mask on, properly fitted, and then they'll give you the appropriate instructions to enter. And that's for both your safety as well as the safety of others around you. Who should not wear a mask? So children younger than 2 years old shouldn't have a mask on. And really, as much as possible, if your young child doesn't have to be out in public, I would keep them home, right? Anyone who has trouble breathing, medically, where a mask would interfere with their breathing, probably shouldn't have a mask on. Anyone who's unconscious, incapacitated, or they can't remove their mask without their help, you don't want a mask on them, because if you put the mask on and they can't remove the mask, they're going to suffocate. So anyone who's unconscious, incapacitated, they can't take the mask on, they shouldn't have a mask on. And then with this specific population, then what you want to do is minimize their exposure. So if they don't have to be out in public, if they don't have to go out shopping or doing the things that we normally do in our daily lives, in the ideal setting, you should not have them outside where they're going to be exposed. If you're visiting, this is about prevention. If you're going to go to a place where there's lots of infections, where the infection rate is high, avoid contact with sick people. Make sure that you wash your hands with soap and water, again, 20 seconds. If you develop fever, cough, you want to wear a medical face mask. Use approved hand sanitizer, which should have at least 60% of an alcohol base in it. That's only if soap and water is not available. Ideally, you want to use soap and water. Birthday song, 20 seconds of hand washing. And in making sure that you wash your hands completely, getting all your fingers under your nail, all of that off. If you don't have access to the soap and water, then what you then choose is to use the alcohol base. Specific complications that you should be aware of. So COVID-19 affects primarily, it's getting in through your mouth, your throat, into your lungs. So some of the first signs are trouble breathing. The complications are pneumonia. And their typical patterns on when they do a chest x-ray or a CAT scan, it's diffuse through both lungs, where you get a diffuse pneumonia. These are complications. That's why a lot of persons end up dying, because they also get what's called acute severe respiratory syndrome, where the amount of oxygen to their lungs, they just can't get enough oxygen for their lungs to work and the blood flow to get that to the rest of their body. Organ failures, your brain, your kidney, heart problems, heart failure. Persons have had blood clots, have lost their legs, things of that nature. A kidney injury, your kidneys don't work, it shuts down your kidney. So on top of getting the complications from COVID, because it really crushes your immune system, then you get predisposed to getting a superimposed or another infection on top of that, another viral infection. You could end up getting influenza, flu, and COVID-19. You could get a bacterial infection on top of that. So that's why prevention is really, really important. I guess I would stress that over and over. Prevention in terms of not getting infected, wearing your mask, 6 feet of distance, washing your hands, and minimizing your exposure to persons who are sick whenever possible. Another pretty picture of the light that kind of just shows the virus again. If you have to travel, so you may know, for example, that Connecticut has a listing of states that are said to be high risk. That's because the rate of community transmission is really high. And if you're coming from that state into Connecticut, there's a device. If you come in from a state that has a really high rate of community infection, once you come into Connecticut, you should quarantine yourself, isolate yourself for 14 days. So if you're going to a specific state, you want to look to see, are there special instructions for you as you enter? If you're going to go to another country, to the Caribbean, to Jamaica, all of these countries will have specific documentation that they'll want you to do. Some countries will have you actually go into a site to enter your information, document your negative test, and then once you land, they'll probably test you again. And then they'll have specific information about how long you need to quarantine. So before you get on that plane, you want to look specifically about where you're going and what the requirements for entry are, because you don't want to end up leaving, landing there, not having the proper documentation, and they basically put you on a plane and send you back. I think I was watching Entertainment Tonight last week, and there were a couple who went to, I think, Hawaii, and they thought they had the proper documentation. So they spent all their money trying to go to vacation. They got there, and apparently they didn't have the appropriate documentation, and the authorities basically put them back on the plane and shipped them back to where they were coming from. You don't want that to happen to you. The CDC, the Centers for Disease Control, and the World Health Organization frequently updates their websites and tells you if there's specific things you need to do specifically around travel. So check those. Be prepared to wear a mask, to practice hand hygiene, and quarantining, all those things that we talked about. If you have specific health conditions before you travel or plan to travel, I would recommend that you talk to your healthcare provider, because there may be specific things that you want to do. If you're diabetic, you want to make sure that you get specific information about what to do. Make sure you pack your medications when you're going, things of that nature. So just kind of planning ahead. So how is a diagnosis made? It's made through your symptoms that we talked about: fever, headache, cough, muscle aches and pains, nausea, vomiting, and diarrhea, those things. Exposure, if you're known to be exposed to somebody who's had COVID-19, you want to contact your healthcare provider, speak to him or her, have them tell you what to do, and then you go in to get your test. We'll talk about the test in a couple minutes. There are several tests available. Most of the test is done by a nose swab. It could be a throat swab. If you're coughing up phlegm, green phlegm, yellow phlegm, they can also test that too. The two types of tests primarily being done now, very briefly, one is called a Pcr. It means a polymerase chain reaction. It basically looks for the genetic material for the virus. And so the PCR test is probably the most accurate. It's a lab test. You do your test, the nose swab, the throat swab, on the saliva, send to the lab. It's present, it's positive. They typically give you the results. Before, it took 7 days or so. If the results are being done, if it's being analyzed actually on site in the hospital, you could have the results back in minutes, 10 minutes, 20 minutes, etc. If it has to go to another lab, it's going to take a couple of days for it to come back. The other test is an antigen test, and that's just a fancy word for the spikes I showed you out of that protein. That's some of the protein that's on the virus. So this test specifically looks for that type of protein. It's on the nasal swab or the throat swab. It's faster. Now the tests are saying for the antigen test is about $5. It's less expensive. And if you're going to test lots of people in the community, that's commonly what's done. So you have those two tests that are there. One of the things you have to be aware of, every single test that we do in medicine, there is always what's called a false negative, or you could have a false positive too. And the false negative means you really have the infection, but the test comes back and says that you don't have it. That's a false negative, right? The antigen test you may do, again, the proteins, the test might says it's negative, but if you have the symptoms, what your healthcare provider will most likely recommend that you do is do the more specific test. That's the PCR test to be sure that we didn't miss it. And you can get multiple tests like you've probably heard with the, at least through the administration, right? So persons who you want to be sure they don't become infected. The president, the vice president, persons like that they actually, because they're traveling around with many people, they probably have had, and they've had multiple tests practically every day to be sure that you're not tested negative one day. It could be a false negative, and then the next they're positive. So you might have to go through multiple tests. And your healthcare provider can walk you through that too, because you yourself, if you have chronic medical conditions, you may need to have multiple tests over a series of time to be sure that you are in fact negative. The other test that's available is an antibody test. Right, so the other test we talked about, the PCR and the antigen, that's a nasal swab, that's the throat swab, that's the saliva. The antibody test is a blood test, and an antibody is a protein, basically, that when you have been infected by something, your body reacts to it and produces a protein to prevent you from getting a future infection. This test, the antibody test, is a blood test. If it's positive, it doesn't say that you're currently infected. It tells you that you've had a past infection. And I'll leave it there for that, because there are a couple of people who have said they've been reinfected. But typically, if you have sufficient antibody in your body, you shouldn't be reinfected with the same type of virus. And again, this is new, it's novel. As we learn more, we can better tell you what's really happening with the antibody test, and does the antibody in your body, does it go away, or do you end up being immune for life? So still under study, more research needs to be done for that. If you are breastfeeding and you have symptoms of or confirmed COVID-19, you should take steps to avoid spreading the virus to your baby, right? So you're going to do the same things as before. Wash your hands frequently. Wash your hands before touching your baby. Wear a cloth face covering, if possible. And when feeding your baby, you want to do the very same thing. If you're using a breast pump, other things a baby use, bottle parts, you want to make sure those are clean After each use, you want to wash your hands very frequently. As of November 19th, right? So there is, I believe there are some approved FDA tests for the home, but these are only done under a doctor's order. They have to approve it. So you do the test at home, send it into the lab, and the analysis is done there. There are no FDA approved home-based tests. So if you go on any website and they're telling you to spend your hard-earned money to get a home-based test that you're going to do in your home, don't do it. Save your money. There's nothing out there, not quite yet, that really is accurate and has been approved by the FDA. Treatment, there's no cure, right? And this is a virus. So if you take an antibiotic, amoxicillin, penicillin, it's not going to do anything for the virus. There's no cure. There's only one FDA-approved treatment right now, and that's the drug that you probably have heard about called remdesivir. The president got it. Other persons, if they're really sick in the hospital, they will get it. And it's only for children and adults older than 12 years old in a hospital who need oxygen and they have serious illness. That's the one approved treatment. The National Institute of Health uses steroid, dexamethasone. Severely ill, you need oxygen, or you're in a ventilator, a breathing machine. The tube is in your mouth, into your lungs, helping you to breathe. There's also the thing that the president got, so plasma, convalescent plasma. And fancy word, it's the antibodies. Somebody got infected before, they produce the antibody that's taken off, and that's given to persons with an acute infection, and typically they're fairly sick. So those are the three things that you can use. No cure, right? If you go to your doctor, these are things we'll end up doing. Supportive care is a fancy word for really just treating your symptoms. Pain relievers, ibuprofen, Tylenol, because you're going to have aches and pains just like you'd have with the flu, a lot of body aches and pain. Cough syrup, medications for coughing, you're going to rest, whatever you typically would do, right? So your chicken soup, your broth, anything like that you would typically do to make yourself well, your teas, increasing your fluid intake, juices, etc. Keep up your hydration. Talk to your doctor about special instructions. Staying home, quarantining. If you're going to be caregiving for someone once they come home, is there a separate space that they could be in? How do you protect yourselves? How do you protect them? And if there are alarm symptoms when you go to the hospital. When you go, these are just some questions that I'll give you later on that you can just remember. You would ask them, how likely is it that the coronavirus is causing your symptoms? If it's not that, what else could be causing it? Is it flu? Is it another viral infection? Is it something else that's going on? What test do you need? Do you need the Pcr test, the antigen test, the antibody test, whatever test you need, a chest x-ray, blood work, all of that. They will walk you through that. What do you do? What action steps do you take, right? How do you keep yourself safe? How do you keep your family safe? Are there restrictions you need to follow? Should you go back to work? When am I healthy to go back to work? If it affected some part of your organ systems, do you need to see a specialist? Things typically that you should be asking your healthcare provider when you're interacting with him or her. The things the doctor will ask you, healthcare provider. When did your symptoms begin? Did you travel? Have you been in contact with anybody that you believe has had COVID-19? Have you been outside without your mask and your gloves and you haven't been doing the things that we recommend? Those things they'll ask you. How severe are your symptoms? Because then they can decide, do you come into the hospital, do you come into the office, or do you go to the hospital? So it really just be truthful in terms of what's been happening to you. And those are common questions they will ask. A fancy picture for a vaccine. Okay, so it's November 19th, and if you've been listening to the news and your tweets, you know that as of right now, November 19th, none is commercially available, but there's several in development. So prevention really is the key. The news that basically broke today was that Pfizer, in conjunction with BioNTech out of Germany, has some promising news about a vaccine that they believe is 90% effective. And then they'll submit the data to the FDA. It will go through the safety and efficacy protocols that they have. And then if the data is convincing, then they'll basically get the approval, probably an emergency approval, ramp up production, and then the entire logistics of getting the vaccine to the community, all that is actually really already happening. So that's the biggest news of November 9th, is that one vaccine that looks pretty promising. There are many other companies that's doing that. A photo to remind you that we're all in this together. It's global. You've got to protect yourself. Where can you get tested? I have the slide very quickly. We're going to show you about what's happening in Hartford. There are community events. Really, every healthcare provider, clinics, CHS, Charter Oak, the hospitals, CVS, other places have that. Most importantly for tonight, really for this week for you to know, are that today's the 9th, so you missed the one that's happening at the Hartford schools. But tomorrow, 11:10, 11:12, Tuesday, if you can see, from 10 to 4, the Montessori Magnet School at Batchelder, 757 New Britain Avenue. Then on Thursday, Thomas J. McDonough Middle School, 111 Hillside Avenue in Hartford. You have to come prepared to put a mask on. It's going to be a tent, social distance. You're going to come, you'll have folks kind of direct where to stop, where to register. Then you get your testing done, and they'll give you the advice about when you'd get the results, etc. So that's for this week. We'll share this again with you to know that both tomorrow and Thursday, the Hartford schools will have these outside under tents. It's safe. Be prepared to wear your mask and to social distance. Testing is free. There's no cost to you if you have insurance. This is just generally, actually, right? So there's no cost to you, but if you have insurance, most likely they'll bill your insurance if that's the case. But if you are undocumented, uninsured, it doesn't matter. It's free. There are multiple grants by the feds and funds that the feds, the state, the city has provided, as well as private folks. If you're uninsured, undocumented, it doesn't matter. Get tested. You should know your status. There is no cost to you. Where else can you go if you need help or information in Hartford? Call 311. There's a whole list of testing sites that can tell you about where to go. You can also call 211. They will give you information about sites where you can go. If you go to their website, and I have that listed later, obviously you should know your zip code. If you go to www.211ct.org, you put your zip code in, they'll list out places where you can get tested. Key takeaways: prevention is the key. Masking is, I'm going to just say masking is a must. Put a mask on, 6 feet, hand wash, and definitely attend the testing events. I'm sure Beverly and Miss Violette will tell you about places subsequently once this phase is over this week. Where else can you go to get tested? But that's the key takeaway. That's the beautiful Bushnell Park. I already told you about 211, November 19th, the testing sites. CVS Blues Avenue, CVS Washington Street. You have to call an appointment. I think you have to go into their website and register. You have to call and you have to register. You just can't show up and then, for those two pieces specifically, call ahead. Obviously, the healthcare providers in the community, Hartford Healthcare, St. Francis, UConn, CHS, others. Call ahead, be prepared to wear a mask, social distance, register, and have some appointments as needed. And we are at the very end. I think I told you all about this. The one other place I would just mention is that if you, and I actually have this, right? So on my phone, I have ct.gov/coronavirus there, and I frequently just look to see for updates. You can also do that. There's also a text. So if you want to get updated news on COVID-19, you would text COVID-19, no space, so COVID-19 to 31996, and you'll frequently get updates for that. Thank you very much. Thank you all the sponsors. You saw this before, and I'm going to stop sharing and open up for questions and answers.
Okay.
Hi, Mr. President.
Thank you, Dr. Rhule. I do have some questions in the chat that I will read. The first one is, do you ever fully recover 100%, or will you always have lingering problems, such as breathing problems forever?
That's a great question. So the majority of persons, I think I showed you the numbers from before, like in Connecticut, I think it's like 9,800, and worldwide 31 million people have recovered. So a lot of people recover and they do well. And part of the problem is that because it's a new virus, only 9 months, they're still looking at the long-term effects, but there is some information to suggest that even after you recover, persons have long-term effects with their brain function, their heart, their kidneys, chronic joint pain. I was reading something last night on the Mayo Clinic's website that they're looking, it's too early, that some of the long-term effects they're thinking might have people being at higher risk for things like dementia, but really it's too early to tell. So yes, some people recover fully with no consequences, but the data currently is suggesting that folks do have some long-term effects, specifically some heart issues, specifically some lung issues, and some kidney problems. And I've seen persons who recovered, they're out of the hospital, and they're still, 3 months later, still using oxygen. It's not a disease that you want, right? It's not a disease that you want. Prevention is the key. I'm just flat out, wear a mask. Wear a mask, social distance, wash your hands.
Okay. Thanks for that. The other question was, you stated that someone may have the virus with no symptoms. How do you protect yourself? I guess.
So that's the thing, right? So a lot of younger person, like a lot of young kids, will be infected and they have nothing, right? Or myself, you could be infected and you have nothing. You could wake up just feeling fatigued, really, and you just think, oh, it's nothing. But if you don't test, you don't know that you've had it. So that's why prevention is the key. You have to assume that everybody is a potential person to get you infected. So that when you're out in public, that's why you wear the mask, your social distance, when you wash your hands, et cetera, you do all of those things. If you're with your family and you know your family, like at home, when I'm home with my family, I don't have a mask on. But if I see that they're coughing, et cetera, they need to either put their mask on and you're going to get a test because then we need to know. So that's what the issue is, because a lot of persons don't have symptoms. You're in the store, you're at work. That person needs to have a mask on because they could be the one who's infecting you, infecting your coworker, infecting your friends. That's why we're saying that the mask really is a thing to do. If not really for yourself, but for other people.
Okay, so how frequently would you suggest that someone get tested in general?
Right, so if you're working from home and you don't have a lot of persons in your home and you're not, like folks are getting their food from online shopping, they're really not out in public, and you're not really exposed, I would suggest you're going to do that one-time test, right? And there's some specific recommendations that really you should be testing probably every month. But in the ideal setting, that's really not going to happen. If you're in a higher risk, so it depends on a couple of things. The type of work that you do, Are you home? Are you constantly exposed? Ideally, if you're really in a high-risk group, you probably should be testing monthly. Healthcare workers, even though most of them are not being tested that frequently, and I believe there's an official recommendation that you get initially with in Connecticut. The recommendation was once a month, but folks have not even done that. So it depends upon your work, your exposure, but really if you could, especially the testing is gonna be the antigen testing, where it's widespread and it's inexpensive, I would probably do it monthly. I've had 2 tests like 3 weeks apart because I was out and I was in the store and someone was coughing. I didn't want to run away when I saw them coughing, so I went and I got tested. But primarily now, I'm primarily at home.
Okay. Can we talk a little bit about the vaccine? I heard that only 40% of the people said they would get it, 60% of doctors, 40% of the community said they would get it. What are your thoughts on the vaccine, especially as it's going to be so new and there will be no long-term results?
Right. So at some point, you have to believe, I have to believe in the scientists, right? So if the scientists have been completely objective, the study has been properly designed, the people who have volunteered really represent the folks who would get it. And they've looked at the safety and efficacy data. And I think I would believe it if the FDA, not because of some political imperative, the public health experts have looked at it. Personally, I would be inclined to take it. And I realize that some folks there's a whole history of communities that we don't trust them because of historically what's happened. So my comment would be this. We know vaccines work, right? You take a mumps vaccine, you take a tetanus vaccine, you take other vaccines. So vaccines really are important. That's part of the toolkit to prevent infection. So vaccines work. So I wouldn't have a problem taking a vaccine. I guess in the question you're asking is, would I take the Pfizer vaccine? Because the technique that's being used for some vaccines are completely different. This particular vaccine is a vaccine that uses a technology called, I told you this was an RNA virus. What they're basically doing in this vaccine, and I hope I'm not misspeaking, they take a part of the genetic material of the virus. You get injected with it, and then your body then basically makes the spike proteins. Your body responds and then does the antibodies to it and fights future infection. So that's the way that technology is. So that's that one. Other vaccines, typically like if you think of a polio vaccine, it's a vaccine that's inactivated. It's a dead virus. You're infected with a dead virus. Your body recognizes it as being strange, and your body then reacts to it. That's a different type of vaccine. So this technology is a little bit different from what we're used to. So the thing that I would look at is, obviously there are probably like many. Moderna is doing a vaccine, Pfizer is doing a vaccine, Johnson & Johnson is doing a vaccine. So I look at it at the type of vaccine that it is, the safety and efficacy data that's out there. And if I had the option, I would do the one that's inactivated with the best safety profile, if it's available. But if it's the one for my age, I'm at high risk, right? So if that's the only one available now, I don't want to be infected. So most likely I would take it, but that's a personal decision. I know that the community, the African-American community, the Afro-Caribbean community, the Hispanic community, because of the historical things that have been done to us and the mistrust, we're skeptical. But broadly, vaccines work. And that's why I applaud you to do this, because the next conversation that we have should also be about vaccines. What's there? What's the best one? If I'm at high risk because of my immune system, do I I wouldn't say hedge my bets, but if that's the only one now for the next 6 months, should I take it? This particular vaccine is 2 shots. So you get one now and you get one a month later. I would, and I'm not going to say you're giving in, I would defer to the scientists. If the public health experts say it's safe and effective, and you go to whomever you trust, your healthcare provider, and you recommend it, I would seriously consider it, and I would take it. If that answers your question.
Okay, that answers the question. It's a lot to think about.
Yeah, but just think about it. You take every other vaccine. You take tetanus, you take MMR, you take diphtheria, you take cholera. If you travel to Africa, you take
a zillion,
right? You never really question who was it studied on, what were the side effects. You take it kind of blindly. I'm not saying you should do it blindly, but vaccines work. So I would be inclined to take it.
Okay. Well, I'm going to open the floor up to anyone who has any additional questions, because I think all the questions have been asked. I know
I have a question. I don't know if you saw it in time.
I do not know if I saw it. Go ahead and ask it.
Okay. My question is, would you recommend people without symptoms get tested? What's the benefit of getting tested if you can now be marked down as having a pre-existing condition if you test positive?
Well, as of today, before November 10th, tomorrow, right, we don't know that a pre-existing condition is going to be an issue for us. And the recommendation really is that everybody needs to be tested, because if you don't get, whether you have symptoms or not, because if you don't get tested, and you don't know if you're positive, because that's the issue. If you don't get tested, you don't know if you're positive, I think people then become a little bit nonchalant. And really what has happened because of the last 9 months, we're COVID weary, I guess is what I'd say, right? So you don't want to wear the mask. You don't want to social distance. So testing really is for everybody. If you look across the globe, the countries that have really flattened the curve, as they say, are countries where practically everybody get tested. They have a testing strategy, whether you have symptoms or not. Those are the countries that have done really, really well. So whether you have symptoms or not, you should get a test. You should still get your test done, know the status. If you think you've been exposed because you're working outside the home, you're a first responder, you're an essential worker, you know people are exposing you. In the big box stores, in Walmart, in Target, they're coughing behind you, you're picking up your groceries, you know you're being exposed, you're going to the gym, you know you're being exposed, you should get tested. And and as of right now, there's nothing to believe that having that diagnosis of COVID-19 then jeopardizes your future health insurance, right? As of right now, we don't know, but just think about it. If that's the case, I forgot the number I gave in the US. It's 10 million people already infected, right? And today the number of persons who are positive test was like 100,000. So if that's your strategy, you're going to end up like eliminating half of the people who have been exposed to COVID. That doesn't make any sense. And just like we weren't vocal before, I would say then you wouldn't be vocal now. If you're COVID-19 positive without symptoms, you get your test. And if there's any inkling that that's going to be used against you for your insurance or your employment, then it behooves the West Indian Foundation and the West Indian Social Club and the Progressive League to organize and let your voices be heard.
Thank you.
Violette, I got a last question. So Gary, so people that test positive for COVID, right? And they have the antibody. Is it possible to, once you have it, you can get it again? Or once you have the antibody, you're essentially immune? Just like you have the chicken pox or whatever, you're immune once you get it once, you can't get it twice. Is that the same for COVID?
So I think the research is out on it. I mean, so the current thought is that once you've been infected, you can't get it again. But there have been about 2 or 3 persons in the US who said, and I've read, they've said they've actually gotten a second infection. And so the question is it the same COVID-19 virus, or is something else happening, that the virus mutated or is mutating, and it's another COVID-19, just like influenza. You have H1N1, H2N2. Is it the same COVID-19, but something is happening with a specific virus about some specific change? The current belief is once you've been infected, you can't get infected again. But there's some, and it's more than anecdotes. There are a couple persons who have been reinfected apparently.
Okay. So my follow-up question is like, say someone like myself, I've never been tested before. And so say I take an antibody test and it says I had COVID at some point, but I just didn't have symptoms. I have it. Okay, so would you recommend such person takes a vaccine then? So if the thought is that once you get it, you can't get it again, would those people have to take a vaccine?
Right. Okay. So the typically, if you're going to like the screenings that we're talking about, you're getting the throat swab, the nasal swab, the saliva, and that's a PCR or the antigen test, right? The antibody test is by blood. So typically, you wouldn't be getting that unless we thought you were exposed before. And your question is good. So typically, if you go to get tested, tested, it's a PCR or the antigen test. If your doctor wants, because they believe you've been infected before, they'll do the antibody test. There still wouldn't be a harm in getting the PCR and antigen test, because it's just the antibody test is telling you past infection.
Mm-hmm.
So they're not going to do that test anyway. What I was going to get to is that if you even have positive antibodies exposed, say for instance, you had no symptoms, right? And you are antibody positive and you didn't know, and you went to get your COVID test, the PCR test potentially could come back and say it's negative, or the antigen could come back and say it's negative, because a lot of it is we really kind of don't know. But if it's negative, so the 2 tests are negative, the antibody is positive, you could still get a vaccine. Because there are people who, for example, have mumps, they've had mumps. And if we don't have your records, we can give you another mumps vaccine. It doesn't really make a difference, technically. Or chickenpox, technically doesn't really make a difference for the antibody. Does that kind of make sense?
Yeah.
So when you go for the testing now, it's not going to be a blood test that they do. It's going to be the swabs.
Okay. Thanks for that. And I'm going to ask the last question that came in. It's about blood type O. Is it true that people with that blood type are less likely to contract the virus?
There is currently, again, there's no such data to support that. I know that was kind of bantered around about blood type in African American. I mean, so no. The initial thing that came out before, I kept on seeing folks saying is that black blood, you won't get COVID-19. That's not true. We know that's not true, right? Just disproportionately, both African Americans, Afro-Caribbean, and Hispanics, for the most part, we have suffered serious illness from it. So we know that's not true. And the blood type issue also is not true.
Okay. Okay. Well, Thank you, Dr. Rhule. This has really been enlightening. I think we've gotten a lot of really good information, and we look forward to hearing you on December 14th, which is our next health series, when we're going to be talking about mental health and COVID-19. So I really appreciate today. We've got good information, and we're all going to get tested before we see you again.
You should all get tested.
We'll
Just to get
all
be sure.
get tested.
Right,
And
right.
let you know the results.
Yeah, definitely get tested.
Okay, thank you so much.
You're welcome.
Everyone, the next health session is December 14th, and our business session is going to be November 23rd. Bev, can you remind me as to what that topic is going to be on November 23rd? You're on mute.
It's on business law.
Business law. Okay.
Yes, how to protect your business, what's your legal status. So it's supposed to be another informative session.
Okay. Thank you very much, and good night, everyone. We will see you, and this is being recorded, and we will post the recording as soon as it's available. Thank you.
Thank you.
Thank you.
Bye.
Thanks.
Thank you.
Good night.
Bye.
Good night.
Good night.